What I'd like to do is to talk to you about why I'm here. And for the last 28 years, as they said, I have been involved with people, helping them to move from that patient to a person. But one of the groups that I had never heard about in all of the time I've been working with people with pain is the farmers and the ranchers. And I was just amazed. I mean, no one ever said this is a group that is completely underserved and we're not paying enough attention to their needs. And so I found out about AgriBillied about 1.5 years ago, and I thought I need to be able to get out and talk to folks. So I wrote a grant, and it was funded by the Allergan Foundation, and that is why I'm here, because I really think that you need to, I mean, you don't get days off, you don't get vacations, you don't get sick days. I mean, you've got to work 24/7 regardless. It is one of the hardest, most dangerous jobs we have, and I think that we have underserved your population, so that's one of the reasons I'm here. So hopefully today you're going to learn a little bit about how do you manage that pain. At the end of the day, during your work, what do you do? So let's hope we can cover that for you. We have been around since 1980. The one thing that we're not is we're not healthcare providers. We don't provide any kind of medical treatment or advice. We work in addition to what your healthcare provider is telling you. And we don't offer a cure, but we offer an education and support to help you through your journey from patient to person. There's our mission, again, is to facilitate support groups to help both the person with pain and their family, and also to generate awareness about the whole issue of pain. Pain is the #1 healthcare condition in the world, in the US, more than anything else. It is the one that causes disability. Let's see, it's 1 out of every 3 people have some form of chronic pain. 1 out of every 3 people. The cost, $150 billion a year. That costs more than cancer and heart disease put together. When was the last time you heard anything about chronic pain? You don't. You hear about heart disease all the time, you hear about cancer, but why not about pain? And I think we've done a disservice to all of those people with pain, and so we really do need to move forward and generate a lot more attention so that our needs will be met. Also, it leaves a lot of people without health care insurance because health care insurance is so expensive. And I know for a fact that a lot of ranchers and farmers don't have health care insurance. Their parents and their parents before them did not have health care insurance. So, I mean, this is it puts you at great risk. Chronic pain turns a functional person into a disabled patient. What the American Chronic Pain hopes to do is to take that patient and help them become a functional person again. And what I want to do right now is let you listen to, as she said, I went to a pain management program at the Cleveland Clinic. The director was Dr. Edward Covington. And so he's going to explain what is chronic pain.
Most pain is temporary and manageable, but chronic pain is different. And because it is different, we need to think about it in very different ways.
In the overwhelming majority of cases, acute pain can be linked to some specific occurrence. There's an inflamed appendix, there's an inflamed joint, there's a broken bone. With chronic pain, there may be no apparent physical injury or illness to explain it. The physician and the patient are accustomed to deal with acute pain, and both naturally expect that some cause will be found, and when it's found, it can be fixed, and at that point the pain will go away. Part of the problem with chronic pain is that when we start looking for an explanation, it's not so much that we're looking in the wrong place, but we may be looking in the wrong time. And what I mean by that is that the presence of a severe pain problem, which exists for some period of time, can actually change the nervous system so that the peripheral nerves are changed. After a period of time, the spinal cord is changed. After a period of time, there are even changes in various levels of the brain. So that to explain a person's pain one day, it may be necessary to look at an illness that actually went away several years earlier.
We don't know everything that there is to know about chronic pain, but here's what we do know. Chronic pain is any pain that continues beyond the expected period of healing for an illness or injury. You can experience pain even if you are no longer ill or if your injuries have healed. In fact, many persons experience pain even in the absence of an apparent cause. But chronic pain has a physiological or neurological basis, even when we don't know what it is. Chronic pain is real.
Okay, so that gives you a good overview of what chronic pain is. You may not know what the cause is, you may not even have a name for it. What I want to focus on here is that pain is very confusing, and one of the reasons is that you never have the same level of pain day in, day out. It goes up, it goes down. You have good days, you have bad days, and that creates a lot of problems, both for us and everyone around us, because they see our level of functioning going up and down, and that becomes very confusing. We'll talk about that a little bit later. But what you have to realize is it's not always the same intensity day in and day out. So our level of function and our abilities are going to go along with our level of pain, okay? Because a lot of people look at you and they go, well, if you can do it today, why can't you do it? Why couldn't you do it, tomorrow? It doesn't make sense. And so we wonder, how did I get this? And for things, some things, they just start happening. And our expectation is that medicine can eliminate anything, right? They can give you new hearts, they can give you new lungs, new liver. They can do so much. Why can't they get rid of the pain in your back or in your foot or in your head or in your neck? It doesn't make sense. That's our expectation. So what we do is we start in this unfortunate maze. That's what it's like when you're in pain. You go into this medical maze and you start going from one place to another, but guess what? You keep hitting these little blocks, don't you? And you're just stuck in there and you keep going around because you really believe there's got to be an answer. There's got to be an answer for what's wrong with you. That makes sense, right? Problem is, pain's invisible. You can't see it. You can't see it, you can't measure it. There is absolutely no way to say, aha, I see, you're at a 10 today, or you're at a 3, or you're at a 5. And it's really hard to put your finger on. And we always tell ourselves, if only I knew what was causing my pain, then I'd be able to deal with it. And I know for 6 years I said that. And I kept thinking, if they could just tell me what's causing this, then I could deal with it. The problem is, once they told me what it was, I thought, well, then fix it, right? If they know what it is, well, then you should be able to fix it. When they just go, I don't know. But the bigger problem with pain is it's not necessarily the pain that's the controlling factor, because it takes total control of your life. It's the fear of the pain. It's afraid, what's going to happen if I do this? What's going to happen if I do this? I get stuck there and the pain peaks. What's going to happen? And it's that fear that controls us. Last time you did something, it really made your pain worse. I'm not going to do that again. And so we start pulling away more and more from first our friends and then our family, and we become very isolated. That fear is a really big controlling factor. We look to our healthcare providers, but they're not trained in pain. In all of the medical education that they get, all of it, they get 2 hours of pain management. That's it. So a surgeon can go for 20 years sometimes. By the time he's done and ready to start practice, 2 hours, that is all they get. So they really don't know how. So when we look to them and they, it's because they don't know how, nor do they have the time, because pain management is not just a simple thing. It's very complex, and we'll start talking about all of that. And they, unfortunately, for a lot of them, they're afraid to treat people with pain. And we've all heard about all the misuse and diversion of medications. And so a lot of physicians just don't want to treat people with pain because they have certain limits that they're allowed to prescribe, and they don't want to deal with it. So what do? They tell you to learn to live with it, right? And this is what it does to you. How do you do that? How do you do that? Learn to live with it. I heard that a lot. Learn to live with it. This is what happens to somebody. What we want more than anything else is someone to say, I believe your pain. That's the first thing. We want that validation. We want somebody to at least acknowledge that even though I may not know what's causing it, I believe you have pain. That is so important. It's that validation. And as we walk down that road and get stuck in that maze, and it's like walking down this foggy road, and the further down you travel looking for those answers and that validation, the more you as a person disappear. And all of a sudden, this pain, and they call themselves, and people with pain say, I'm a chronic pain patient. And they lose who they are, and their pain becomes their identity. And that is so dangerous, because think about it. You're a lot more than your pain. You're a person with pain. You're a person with blue eyes. You're a person with so many talents. Why does the pain have to override all of that? That's a big problem with chronic pain. Our life experiences are going to impact how we're going to deal with our pain, and especially in your community. I mean, your parents and the parents before them, they continued. It didn't matter if they got hurt. They had to do it. The animals needed taken care of. The crops needed to be harvested. I mean, you just didn't stop. It was expected of you. And so that's what you're thinking. And we'll talk about pacing and that in a minute. The different thing about being a person with pain and being another kind of the typical medical model is that expectation of when you get sick, cold, flu, even surgery, people take care of you. They take care of you, and you're the passive patient. The problem with chronic pain is you can't be passive, because you can't just sit there and wait for somebody to help you, because it's not going to work. You have to take an active role in the recovery process. You have to step up, and we're going to talk about what that means. What are some of the things that you can do to make that transition from a patient back to a person? And the bigger thing is, it's not as much, I mean, it's so important for us to know what caused our pain. And for some of us, we may not have an answer, but that doesn't mean it's not real. But the more important thing is not what caused your pain, but how are you going to deal with it? How are you going to deal with this pain that is completely and totally taking over your life? And it's not just your life, it's your family. And it's like you all got stuck in this big wave, and it just is turning you around and around. We know what the force of water can do. It's so powerful, you can't resist it. And it just keeps spinning you around. You don't know what's up, you don't know what's down. People with pain, they feel very helpless and hopeless. When the healthcare providers keep going, I don't know, that doesn't feel real good, because we expect them to give us answers. Or they'll say, well, maybe it's because you're depressed. Think about this. If you had the flu for a year, would you be a happy camper? Of course it's depressing, but it doesn't mean that the pain was caused by depression. If you're really happy that you have pain, then we do have a problem. But I don't know that that's going to be the case. I mean, we want, and all I ever hear from people when they call is, I want my life back. That's what we all want. We want our life back. We're angry. I mean, why did this happen to me? I was just getting going. I had a good life. How did it happen? Confused. Why can't healthcare providers take care of this? There should be a reason. We feel guilty, and that's a big one, because we can't fulfill our role. And the way we evaluate our worth for so many of us is by how much we can accomplish in a day. And if we can't accomplish what we're supposed to in a day, then we're worthless, right? Not right, but that's the way we think. And we're also out of control. We don't know what to do. We just don't know what to do. Where do you turn? Where do you turn? What's really interesting, your family experiences those same emotions. There's only one difference, and we have a manual now for family members. And for 3 years, I don't know what it's like to live with someone with pain. I only know what it's like to live with the pain. And for 3 years, I had to interview family members and talk to them to get an understanding of what they were going through and what were their needs and some of the struggles that they had. And in all that time, I would have thought I was just talking to people with pain, because there's only one difference between the family member and the person with pain, and that is the family member does not feel the pain. All this, they have, same thing, they're feeling it too. We don't realize that, but they really are. And children as well. So let's talk about how do we start taking that active role. The first thing is, when you go to your doctors, you need to be prepared. You know, times have changed, especially in the medical community, and you may get 5, if you get 10 minutes, you're really doing good. But maybe 5 minutes, I think the average is like 7 minutes with your doctor. So that's a valuable piece of time, so we should be prepared before we go to our doctors. So what you need to do is get out 1 sheet of paper, no more than that, just 1 sheet. And the first thing you want to write down, and these are going to be just bullet points, brief words, what you want to do is write down what has happened, what is new since the last time you saw them. And you can start putting these in a binder so you'll have this and you can even refer back to what was there before. What's new since the last time you saw them? The current medications that you're on. And we do have, and I think they're back there, little medication cards where you can actually fill them all out and carry it with you. But when you're listing those current medications, make sure that you include over-the-counter and that you include vitamins and even herbal supplements. That's all critical. Unless, what I always kept thinking is if you just look at me, you're gonna know, right? They're gonna know what's happening with me if they just look at me. Well, they can't read our minds, and unless we tell our healthcare provider things, they're not gonna know. Blood tests don't show it all the time. We have to be part of that team. We have to communicate with them. Changes in your, mood, your appetite, your level of activity, methods that you've tried. Did heat help? Did cold help? And again, bullet points, short words, so that you can make the most of that time. Any questions that you have, write them down. Every time I go, I think, okay, I'm gonna ask this and this question, and I, do as I say, not as I do, and I sometimes don't write them down. And I'm driving home going, why didn't I ask that question? Why didn't I ask it? Well, if I had written it down on this nice little sheet of paper, it would have been right there. And most importantly, what you want to do is take someone with you if you can, because we don't always hear what they say. And we're processing it through not only how we're feeling physically, but emotionally, we're processing what we're hearing. And I know for me, and there would be, they'd run another test trying to figure out this is what it is. I was going to get the answer the next time. My expectation was this is the one. This is going to be it. The problem is I'd go in and they'd say, the test is negative. The test is negative. I don't know. I don't know where we can go from there, or you're just going to have to learn to live with it. It was a good thing it wasn't this. But what I heard is, there's nothing wrong with you. It's all in your head. You're crazy. Because that's what I was feeling. That's how I was feeling. Like, it must be my fault. Our expectation is that, we somehow failed our healthcare provider. So take someone with you. Have them take an active role as well. This is a tool, and that's what's being passed around right now. This is one of the tools that we have. It's designed to help you communicate with your healthcare provider. And so they always ask you your pain score. So there it is. And what is your pain level? But then it's going to ask you your stress level, your activity, your exercise, your sleep, and on the back is your appetite, your mood, how isolated you've become, how much alcohol you consume, and how worried you are about finances. Now, we encourage healthcare providers to keep this out at the front desk when you sign in. Circle those. Just look at it. It doesn't take much time. You don't have to write anything out. Just look at them, circle them, and you go in and you give it to them. This is a wonderful communication tool because you're telling them this is what's going on with me at a glance. And so instead of using that valuable time, and remember, we want validation. So we're going to try to get them to feel our pain, to really understand it, which is never going to happen. One of the things I kept trying to do was thinking, how can I best explain this to my healthcare provider? How can I make them understand how bad this pain is? And the more I thought about it, and I was trying to think of just the right words, and I kept thinking about it and thinking about it and thinking about how my pain felt. The problem is, the more I thought about it, the more I suffered. I gave all my attention to my pain. And that's not necessarily a good thing. So here's a good way to evaluate everything, get this information out, so that you can use that precious 5 to 10 minutes that you get with your doctor on how to solve a problem, rather than what is the problem. This next one is called, we call him Nerve Man, and it was a program that we did called It Takes Nerve on neuropathic pain. And if you go to our website, and it's on the back of your handouts and on everything else, you'll see there's a section on It Takes Nerve. And all you have to do is click on that. And when you get to that, Nerve Man is going to come up, and there we go. And this is what our page looks like. And you're going to go down and click on Go to Symptoms right there. And then as you run your cursor over his body, okay, see on the foot? But now as you look at this, electrical shocks, pins and needles, he's animated. He's kind of cute. He's real animated. I like the fire the best, the burning. Numbness. But see, when you say, okay, I have numbness in my feet, and you click on that, it's going to stay clicked, and on your legs. And you can go up on his entire body and click how it feels and where it's at. And then you can go up and you can print this, and it'll all stay there. Take that into your doctor and say, this is where it hurts and this is how it feels. What a wonderful communication tool. Again, it's making the most of your visit with your healthcare provider. And this is on our webpage. It's free. You can just go in and do it anytime you want. This is another tool that we have. What I really used to hate is when they'd ask me on a scale of 0 to 10, what's your pain? Okay? Well, you know, I was in my late 20s, early 30s, had 2 small children, and I was no longer able to take care of them, my husband, my house, nothing. And so if 10 was the worst pain in the world, why was it 20? But if you told them it was a 20, they'd think you're nuts, right? They go, in that case, right away. It never really explained. So what we did is we decided that you needed to really measure your function, not your pain, because that's really where it's at. So if you have a 0, it means you don't function at all, nothing. You can't even get out of bed. All the way up to a 10, where you can get out of bed, get dressed, do your normal activities. You can go plow the field, milk the cows, whatever you need to do. You know, fix the tractor that day. You can do anything. And there's all of these in between. So when they ask you what's your pain level, and you use this scale, then you begin to demonstrate, this is what my pain level is, because this is what I can do. And that's really where it's at. It's about our quality of life. That's really what it's about. Medications. And this is something we all think this is what we need, just the right pill, right? You get a headache, what do? You take an aspirin, Tylenol, Advil, any of those things. You get an infection, they give you an antibiotic. I mean, there's all these wonderful miracle drugs. So they should just be able to give you that pill, right? The problem is it's only one of the tools. And even if you do have the right one, and again, our expectation is if it's the right one, I'm going to feel like I did before the pain. That's our expectation. However, if it's the right one, it may reduce your pain a little bit, may allow you to sleep at night, but it may not take it away 100% because it's only one of the many tools. It's not the whole ball of wax. And I think that's what we expect. And every medication has benefits and risk. And on the back table, we have something called the medication supplement that we put out every year. It's on our webpage as well, but there's printed copies back there. And it talks about all of the medications because you really need to understand what they are and what they're for. And we're also converting that into a video format so that you can actually hear people talk about their questions about medications and having the experts actually answer them. So and that'll all be on our webpage, and that will be free as well. Early 2009, we'll start that. You really need, and as I said before, you have to make sure people think if it's over the counter, it's safe. It's not. Look, ask your pharmacist. You know, go to the same pharmacist for everything. That way they're going to have a record. They're going to know if interactions. Vitamins, all of those can be issues. When we go to the doctor, they give you a prescription, and they tell you why they're giving it to you, what it's for, how to take it, and you go, thank you very much. And you don't ask questions because you don't want to look stupid, right? Now, if you were that smart, you'd be the doctor. Think about it. Okay, and then you go to the pharmacy, and the pharmacist may come out and tell you, a new prescription, this is how you're supposed to take it, and you go, thank you very much. There's a whole line of people there, and it's like, I don't want them to hear this. I don't want them to know what I'm taking. So you just sort of go, thank you, and then you go home. And then you look at this bottle of pills, and you go, now what did they tell me? What's this for? How am I supposed to take this again? Because, they can only get so much information on that little label. So we've designed this to help people better understand how to take their medication. Take it in the morning or take it at night? Or what time of the day should you take it? Put in the little times. Should take it on a full stomach, an empty stomach. Possible things to avoid: driving, alcohol, sun, dairy products, and vitamins. And then possible side effects. It may cause drowsiness, blurred vision, dry mouth, or constipation. But this is something, if you pull it out and you look at it, you go, okay, I'm supposed to take it in the morning on an empty stomach. It's right there. It's in a picture, even if you're a little groggy. And on the back of the form are resources that are very helpful. This is another program that we did in case of emergency. This is also now on our webpage. Our expectations when we go to the emergency department. What do we really expect? We did a survey. We worked with the American College of Emergency Physicians. And we did this whole survey about people with pain and their expectations about going to the emergency room, how that worked out for them. All of that information is on our webpage. But we also designed this little booklet. And this one helps you to really understand what happens in the emergency department. And remember, not all physicians want to treat people with pain. And what we found out are there are a lot of people who called their healthcare provider and they said, go to the emergency department. So you find yourself there. So you really do need to be prepared. You need to know what kind of questions to ask. You need to know how to give them the history that they need. So we have this little form on our webpage. And on the front side, you want to put all your basic information, insurance information. Again, list all the medications that you're on. Keep this with your car keys. Fold it up, keep it in the same drawer wherever you keep your car keys. It's not that big of a piece of paper. And then on the back, when you get there, you can begin to look at where the pain is and draw that for them. So again, that when you get in there to see the ER person, you'll be able to say, okay, this is what happened, this is how it happened, and give them a little history. It gives you more time to think about it and be prepared. And what are your expectations? And remember, this is just a one-time. This isn't your healthcare provider. A lot of people go in there thinking they're going to do more tests, they're going to do more x-rays, they're going to give me the answer. And that's usually not what's going to happen. To live with pain, you've got to become part of the treatment team. You can't be that passive patient because it's just not going to work. You have to take an active role in the process. You have to work with your doctor to find the best thing that manages. And your goal, more than anything else, your goal is to reduce your sense of suffering and improve the quality of your life. It may not be getting rid of the pain, but that doesn't mean that you can't live with a certain level of pain. When all is said and done, or they may have done absolutely everything they can for you, and you still may have some level of pain. And that's hard for us to accept, but that may be the reality at that moment. When you're told to learn to live with pain, this is what I think it looks like. And I have no idea what that is on the board. It could be solved for all I know. I have absolutely clueless. And if someone asked me to solve this before I could leave this room, I might as well just get to bed and say, I'm going to be here the rest of my life. I could not do it. I don't know even where to begin. And that's what it feels like when someone says, learn to live with it. Who knows? However, think about this. If I took a few classes, maybe in algebra to start with, some plain geometry, some trig, differential equations, and really worked at it, I bet I could solve that problem. I bet I could solve that problem. But it's not going to just happen. I have to take that active role. I have to make an effort to figure out how to do that. I need experts to tell me how to do algebra. You need that. And it's the same with pain. And the tools, the coping skills that we teach are universal. It doesn't matter what the cause of the pain is, because these tools can apply to anything, whether you have fibromyalgia, whether you have low back pain, whether you have postherpetic neuralgia, all of those. The coping skills are good for all of those. It depends on what your needs are, what tools you're going to pull out. So we're going to try to give you the beginning of the toolbox for you to begin to look at, and it'll just depend on what your needs are and where you begin. And we're going to talk about our 10 steps from patient to person. And these were designed not like the typical 12-step programs. You don't need to do step 1, step 2, step 3 in that order. What you need to do, though, the first 2, I think, are really important. Because the first one is accepting the pain, and that is by far the hardest thing. Because when I tell people, the first step is accepting the pain, they think that we're saying, road's closed, you're done, it's all over. When in fact, it's just a detour in your life. It's just a detour. It's not the end of the world. We just have to figure out how to get down that road. It means to educate yourself, to begin to understand it, and for today, this is the way it is. That doesn't mean tomorrow is not going to be better or there's not going to be an answer for you tomorrow. But if we keep waiting and sitting there doing nothing, then we're only going to get worse and worse and worse. Now, I have a little short video here of some of our members talking about accepting the pain.
Your pain will be a factor in your life, but it will not be who you are. By taking stock of your strengths and limitations and reminding yourself of the things that are important to you, you'll begin to find ways to move forward in spite of your pain.
You will get better. For as impossible as you think this experience is, there is a way through it and beyond it. And I am living proof of that.
Put your faith in someone that you trust, a physician that you know is going to help you through this process, and give it a chance.
Educate yourself on whatever the particular pain is.
I can't think about past today. I live this thing one day at a time.
Don't give up. There is help out there. You're not the only person in the whole world.
Pain is inevitable, but misery is an option.
It's a journey that we do together. It's not about the destination. It's about the journey itself.
You didn't invite pain into your life, and you don't have to let it take over. You can reclaim the life that belongs to you.
I'm a different person now. The old Ruthie is gone. She's dead. I don't think she'll ever come back. But truthfully, I like the new Ruthie better than I did the old Ruthie.
And where I am now is I have more power than I ever had, even though I'm less physically capable than I used to be.
And I don't do all the things that I once did, but I still have that joy. Music is a great joy to me and fills my heart with a lot of happiness.
Helping my daughter plan her wedding and just doing all that fun stuff in showers and actually being at the reception and dancing. That was great. Boy, that was one of the best days of my life.
My life now it's like I'm coming up out of a hole and coming into sunshine, and I feel real good about it.
Every few months, I take a deep breath and I get in the car and I drive to Cincinnati, Ohio, and then I drive to Louisville, Kentucky, or Frostburg, Maryland. I don't know how I do it, but there's grandchildren at the end of the road, and I can do it.
I've been living with pain for a total of 15 years. 4 years of night and 11 years of light.
Getting involved, and we've been talking about that, being an active participant, doing what you can, asking your doctor, what can I do, what else can I do? Do a little more research, find out things, go on the internet. Our website has a lot of links to useful sites. I mean, there's a lot of stuff out there on the internet that's not good, so be very careful about what you look at. If you don't have the internet and you want to get some information, call our office because we'll actually go through it and print out stuff for you and send it to you, because information is critical for you to understand. Remember, it's the fear that's the controlling factor. So the more we educate ourselves and understand the process and our expectations, then it may take away some of that stress that we're feeling about managing the pain. Setting priorities, that's a good coping skill for pain. And why is that good? Because the pain takes over our lives. We begin to put things off. We can't do this today. We can't do this today. So we start building this little pile over here. And we put things over there that we can't get done for the day, for the week, for the month. And this little pile gets bigger and bigger and bigger and bigger until we've got this mountain looking at us. And every time you think about all this stuff, you're completely and totally overwhelmed. So what do? Nothing. You don't know where to start. It's too much. And a priority, being able to recognize your priorities gives you a starting point. But how do you do that? Here's a good way to begin to understand and recognize your priorities. On your way home, I want you to get about 300 of those little index cards, 3x5 cards. You need about 300 because you got a big mountain over here. And every time, carry about 20 of them or so with you all the time. And every time you think about something that you put over here, that you put off, whether it's work-related or even something that you enjoy doing and you didn't do it because you didn't feel good, everything that's on that pile, write it down. It may take you a week, it may take you 3 weeks, it may take you 3 months. But when you think you finally have all that stuff identified, and that's why you need 300 cards, when you think you have it all identified, you want to get a really big table, or you may need the floor, and lay them all down, face up, and just look at all the stuff you have on those cards. My God, how hard is that to carry all that around? Because it's really been on our shoulders all that time. The mountain's really not sitting there, it's sitting here. That's a huge amount to be carrying around, and it keeps nagging at us. And then as you look at all this stuff and look at every card closely, ask yourself, of all this stuff here, right at this moment, what's the most important thing to me? And you pick up that card and you've now got your first priority. And say maybe the next 10, 15 things that might be important, you pick those up and you take them with you. The rest you all just stack. And they're not going anywhere. You know what you have to do, and it's all right there. And the reason they're on separate cards is so that you can shift them. It's never etched in stone. You can shift your priorities. You don't always have to worry about, I have to do this before I get this done. We have to be flexible. It's a wonderful way because it helps you to focus, narrow down, work within your limits. Once you have your priorities, you really need to start setting realistic goals for yourself. Remember I said that we tend to value ourselves by how much we accomplish in a day, right? People with pain tend to be overachievers, not me, most people. And so we push ourselves beyond our limits because we have to get all these things done, right? But let's be realistic. You're setting yourself up for failure. Remember we talked about the pain, good days, bad days, up and down? What do you do on a really good day when you're feeling okay? You go out there and try to catch up on everything you possibly can in that one day, right? And then the next day, what happens? You can't move. Or the day after that, you cannot move because you've way overstepped your limits. You weren't realistic. You weren't, staying within your limits. You weren't pacing yourself. You were trying to prove yourself, and that's a problem. I can still do this. I know I can. I did it. One good day, and man, I was out there, and then it was like, and then you go back to the doctor and say, it didn't work. Well, hello. Maybe I was part of the problem. So you have to be realistic about your goals. You really have to narrow them down. And so many of us think, okay, if I have a good day, I can get up and start running again. And what you have to realize is you have to start walking again, one step at a time. And what's wrong with setting one of your goals around something that's enjoyable? So the next time you have a good day, do something fun. You don't have to be productive every second of the day. You can narrow those down until they're small, manageable steps. We had a woman in one of our groups. She had diabetic neuropathy, so her fingers and her feet were numb. And it was hard for her to do a lot of stuff. I mean, even buttoning something as simple as buttoning your clothes, when your hands are numb, that's a problem. Most people don't realize that. And one of the things she enjoyed more than anything else was baking for her family, something she could no longer do because it just took too much time on her feet, too much coordination with her hands that she couldn't do it. And so her goal was to bake cookies that whole month. That was it. Now, for most people that don't have pain, it's like, that's silly. That shouldn't even be a goal. That's, it's an easy thing to do. But every day, she would try to do this. And so she decided that's her goal for this month. And so every week she'd do something else. She'd come back, she'd tell the group, we talk about it. How can you move this forward? At one point, she froze the dough. By the end of the month, she had baked those cookies by herself with no help from anyone. And you would have thought she just climbed Mount Everest. It was the best thing, and the whole group actually felt good about it because we all helped her by walking through with her, giving her the support she needs, the encouragement that she needs. So, think about it. You have to do it one step at a time. And if you think you have a goal that's realistic, then ask yourself, how can I break this one down? Make it as small little steps. and be good to yourself. Don't be your own worst enemy. I was that. I was definitely that. Your basic rights. This is my favorite one. No one ever told me. And if we start new groups, I always say start your basic rights. No one ever told me I had rights. No one ever told me that I had the right to make mistakes. The whole organization has been built on my mistakes. I can make mistakes, and it's okay. And I can also do less than humanly possible. Imagine that. I don't have to be that 100% of the time when you're up working, work all the time. I don't have to do that. I can do less than humanly possible. It's okay. You're allowed to do that. Here's all of the rights. You have the right to ask for help. You have the right to change your mind. Just because you said you're going to do it, you know, you can change your mind. And you don't have to justify your behavior. You don't have to do that. So you don't have to explain exactly why you didn't do this or why you did do this. I mean, I used to always try to explain. And what happens when we try to justify our behavior is we put ourselves back into that patient role because our pain becomes the excuse. But you can just say, you know, no. And you don't have to justify your behavior. And you're also allowed to say no and not feel guilty. Other people do it. They say no. You have the right to change your mind. You have the right to stop and think before you respond. You know, in this fast-paced world, it's like, give me the answer now. He said, well, let me think about it and I'll get back to you. That is really powerful. You have the right to be treated with dignity and respect. And that also means by your healthcare providers. And if they aren't meeting your needs, you can change your mind. And maybe think about getting someone else, even if they've been with your family forever. If they're not meeting your needs, you can change. Ask yourself, who's paying who? Right? You wouldn't take your car to a mechanic and let him screw it all up and then say, thank you very much, and go back to them next time. I'm not saying that your healthcare provider is messing it up, but if you're not happy with the service, you don't do it. You have the right to change your mind. You have the right to be treated with dignity and respect. All of these rights. What we try to have people do is actually, they're on our webpage, print them out, and look at them every day. These are very empowering, and they really do help you feel like, maybe I'm equal, because we begin to feel like second-class, third-class citizens because of our pain, like we failed not only ourselves, but the whole world. This is a hard one. This is a hard one. Remember I said, and you always hear some, you know, it's all in your head or you're just depressed. So when it comes to, you know, emotions and pain, it gets a little touchy. We get a little touchy about it. And I know when I went to the pain program, and I will tell you this right now, that for 6 years, we looked and looked and looked for an answer, and there was no answer. And I just kept hearing, learn to live with it. And I went to the Cleveland Clinic, and somebody said to me, I can teach you how to live with it. And my husband was just so happy. And I thought, I want to quit. I just want to quit. I'm done. I'm done. After 6 years, I'm done. I don't want to do this anymore. I've done it. I'm tired. But he wouldn't let me quit. I was so mad. And I thought, all right, then I'm going to go. And I'll show you, it's not going to work. So I went to a pain program not because I believed it was going to help me, but because I was going to fail. I was going to prove this didn't work. So all this stuff I'm telling you, I didn't believe any of it either, because I was going to prove to him, nothing can help me. I'm done. I'm a lost cause. Obviously, that didn't happen. 29 years later, here I am, functioning as a person. But one of the things they did when I first went onto the program is they gave me this book called The Angry Book. It's still available today. It's called The Angry Book by Theodore Rubin. Little, not very big. And they said, you have to read this book. Well, I'm thinking, all right, you know, I'm here because I'm in pain, and you're telling me to book about anger, and I'm not angry, but then I was really angry. So I thought, why would you ask me to read this book? What does this have to do with my pain? But I always did what I was told. So I read the book. It's a very easy book to read. Got it done that night. What else is there to do? And I'm reading this book, and as I read each chapter, I go, my God, that's me. That's me. I'm really an angry person. I was the angriest person in the world. By the time I got done with that book, it was horrible. I felt so bad. But there was one thing that I remembered more than anything else from that book. At the end of the book, he talked about your slush fund. And I sort of imagined that as a bucket. And every time you don't deal with an emotion, you put a drop of water in your bucket. And guess what happens? Every time you don't deal with another emotion, and anger is not all yelling and screaming. You know, there's a lot of forms of anger, like, oh, don't worry about me, go ahead, go without me, you know, no big deal, right, you should stay home with me and be with me, but that's not what you say. But every time you do those kinds of things, every time you suppress a negative emotion, you put it in a bucket. And at some point, what's going to happen? That last drop is going to overflow. And that's what happens with our anger. We keep doing that, putting it here until it is so strong, we just explode. And we usually dump our bucket onto somebody who's safe. And they're standing there going, I just said one little thing and they just exploded on me and dumped all this, because they're dumping their whole bucket on you from how long? I mean, you've been carrying this bucket around, and think about how heavy that is. Holding all those emotions in. Do you know how much that takes? You ever carry a bucket of water around for about a week, a full bucket? Try it. It's going to make you really tired. And you do that when you carry around your emotions. And you have never, ever, probably never held in a positive or a happy emotion. Only the negative ones. Why do we do that? Feelings, we can't control them. You're allowed to feel whatever you want. The only control you have is on your actions. There are no wrong feelings. And so if you begin to tell people, say, you hurt my feelings. Well, you said that, or whatever, express yourself. None of it's going to be that big, but somehow we wait until it gets this big, and then it's inappropriate. And then we look a little nuts because, you know, we're just going on and on and on. I like to use this little picture here because it demonstrates. This man here, I have a story about him, he's the one with pain, and here's his wife. Now, he's one of those, don't worry about me, I'm just going to hold it all in. You can just see he's holding it, right? It's affecting her. Look at that. You know, if they had just communicated, if he had just said, you know, well, this is really bothering me, or this is how I'm feeling, you know, she would be pulled in, be part of it, they would be a couple, they would communicate, and we wouldn't have this massive wall that is between them. And the problem is, if you don't start communicating and recognizing feelings, that gap gets bigger and bigger and bigger. So it's really important. Your feelings, again, are really a part of it. And it's not just, you know, when they say it's all in your head, well, it is. But it's in your body too. You can't separate them. Our mind and our body are connected. They come as a package deal. What we feel emotionally has effect on us physically. And what we feel physically has an effect on us emotionally. It's a package deal. Depression is part of pain. Learn to relax. Just relax, right? Now, if we could go to this wonderful little South Seas island somewhere, lay on that nice, warm, sandy beach, listen to those waves crashing against the shore, hear the rustle of wind through the palm trees, we might feel a little better, right? But that's not possible. What I want you to do for me right now, every one of you, I want you to yourselves to count from 1 to 25, and at exactly the same time, say your alphabet. Can't do it, can you? You know why? You have a one-track mind. You have a one-track mind, you really do. And so, say you're laying on this wonderful little sandy beach, imagining yourself laying on this little beach, and you can just pick up that sand, you know how it feels sort of warm and silky going through your fingers, curl your toes in that sand a little bit, hear those birds going overhead. While you're thinking of that, for that few moments, you're not thinking about, oh my God, my back is killing me. Doesn't mean the pain's not there, but what it means is you've reduced your sense of suffering. You've reduced your, and that's one of our goals, right? To reduce our sense of suffering. When I was in the pain program, I had these sessions called biofeedback, and they hook you up, your fingers and your forehead to monitor, and the whole idea is this big machine, as they read this wonderful little relaxation text to you, you're supposed to be able to turn the sound off, right? Well, I had 4 of them, and I really wanted to do that. So I'd try so hard. And this man was this wonderful voice reading this wonderful relaxation text. The more he read it, the more tense I got because I'm trying so hard, right? Really trying. So it went up more. I failed terribly. However, what he did for me was he recorded those sessions, and he gave me the tapes. He said, when you go home, practice them. And so I did. And I listened to them, and there was a point, several months, I don't even remember how long it is, but a long time ago, I actually didn't need the tapes anymore. Didn't need the tapes. It's a learned skill. One of the things that we do, remember we talked about the up and down, good days, bad days? But when you're out there working, and when your body goes, ouch, just a little ouch, what do? You keep pushing through, right? Keep pushing through. I can do one more, can do one more, can do one more. We don't listen to what our body's telling us. It's screaming, and we wait until it screams before we listen to it. But if you just listen to your body when it goes ouch, and take a couple minutes doing some kind of a relaxation skill, get it under control, it's not going to go to the next level. We're pushers. Remember I said we're overachievers. Certainly we're our own worst enemy. So listen to what it's telling you. When it says ouch, slow down. Give it 5 minutes. Now what I'm going to do next is play a little video that we have actually on our webpage. It's a 5-minute relaxation text. It's free. Just go on, click on it, and it'll play. This is going to give you an example of how a relaxation text works. We have we have a bunch of tapes. There are tapes, all kinds of tapes, and it depends on what your needs are, what one you're going to like best. But just remember, it takes practice. It takes practice. So what I want you to do now is sort of get comfortable. If you want to kick off your shoes, if you want to lay down on the floor, that's okay too. And just listen. Ready? Okay, here we go. Close your eyes gently. Settle down comfortably. Begin by breathing out first. Then breathe in easily, just as much as you need. Now, breathe out slowly with a slight sigh. And as you breathe out, feel the tension begin to drain away. Then go back to your ordinary breathing. Even, quiet, and steady. Now, direct your thoughts to each part of your body, to your muscles and joints. Think first about your left foot. Your toes are relaxed and still. Your foot is resting easily on the floor. Now your right foot, toes, ankles. Now, think about your legs. Your thighs roll outward when they are relaxed, so let them go. Your back muscles will relax when you hold yourself upright and your spine is supported by the back of the chair. Let your abdominal muscles become soft and relaxed. There is no need to hold your tummy in tightly. It rises and falls as you breathe quietly. Think about the fingers on your left hand. They are curved, limp, quiet, and still. Now the fingers on your right hand. Relaxed, soft, and still. This feeling of relaxation spreads up your arms to your shoulders. Let your shoulders relax. Let them drop easily. Your neck muscles will relax if your head is held upright, resting easily balanced on the top of your spine. Let your face relax. Let the expression come off it. Make sure that your teeth are not held tightly together, and let your jaw rest in its relaxed position. Your cheeks are soft because there is no need to keep up an expression. Your lips are soft and hardly touching. Relax your forehead so it feels a little wider and a little higher than before. Now, instead of thinking of yourself in parts, become aware of the all-over sensation of letting go, of quiet and rest. When your muscles are relaxed, you begin to feel peaceful, rested, and quiet. Stay like this, listening to your breathing for a moment. Now, wiggle your hands and legs a little, and open your eyes and sit quietly for a moment. Okay, that gives you just a little idea of what it's like to go through a relaxation exercise. What it does, it begins to make you aware of your body, the different parts, little signals. I mean, ask yourself during the day, I mean, are you holding your hands tight in a fist? Are you clenching your teeth? These little signs are good indications of maybe you're a little bit stressed. And guess what happens when you're stressed? Tight muscles are gonna hurt more. You know, pain is not all in your head, it's in your body too. And so, you know, when you're stressed, it's going to increase your pain levels. So you have to tell your body how it is you want it to feel. And it is possible, but we have to pay attention to what our body's telling us. We can't push day in, day out. So if you're out there working, what's wrong with taking just a couple minutes and collecting yourself, as they say? You know, I personally like the breath relaxation. That's the one that I can do best. Imagining my breath as a substance, and as you breathe in that air, you know, what color is it? What's it look like? And then as you know, it goes down into your lungs. How does it look as it fills up your lungs? And does it change color, texture? You know, and hold it there for a minute. You can feel how tense your lungs get. And then as you breathe out, you know, is it a different color? Is it a substance? Just things like that. But again, it is a learned skill, which means you have to practice it. And you may practice and find yourself getting a little tense at first. It's because we try too hard. But with time, you can begin to listen to your body and then tell it how it is you want it to feel. No matter what you're doing, even out there in the fields, you can still, you know, in the barn, you can still take a couple minutes. Listen to your body and tell it how it is you want it to feel. Exercise, that's a really hard one. And people think, you know, and I know that they'd say, you know, I go in, I do something during the day, and if it hurt, when you go back to your doctor, say, I kept doing this and it hurt. And they said, well, then don't do it anymore. So we got to the point where I didn't do anything. After 6 years, my pain was so bad that holding a cup of coffee was difficult for me. That's how deconditioned I became. I was completely non-functional, which is not me at all. But when we do something and it hurts, we think our body's telling us shouldn't do that anymore, right? That's not necessarily true. And so what you need to do is talk with your healthcare provider, see what your limits are. Because sometimes it's like sitting around all winter long. The snow, the cold. First time you go out there and really become physical, you really hurt, don't you? Well, imagine somebody with pain who eliminates the activities over and over again, and pretty soon you're not doing much, but then you have one of those good days and you go out there and you do everything. What happens? You're gonna hurt. You're gonna hurt because you overachieved. You're also gonna hurt because your body was not used to it. It had become deconditioned. A really sad fact is that for every day you spend in bed, 24 hours, it's going to take you 2 weeks to get back to where you were. That's really depressing. I mean, 2 weeks is a lot of time to get back one day. So the more inactive we are, the more likely is when we do become active again, our pain's going to start hurting. Another problem is that we don't see like we're making progress because we say, well, you know, I did this and it hurt and I'm still in pain and I'm still in pain and day after day we're in pain. We don't realize that maybe we're actually able to do a little bit more than we could before. But we don't see that because as long as the pain is still there, we figure we haven't made any progress. And that's why it's so important to journal. And this is a good thing to journal on is your exercise, your activity level. You can use those little pain logs. We have them in a 31-page spiral bound that you can just journal every day on that to know exactly how you're doing. It's sort of like trying to watch your hair grow. We know it grows. We have to get it cut. But yet, if you stood in front of a mirror and watched it, you'd be there for a long time, a very long time. And you wouldn't see anything happen, would you? Because it's so slow. And that's how it is with people with pain. We may take 5 steps forward and fall back 3, so we think that's it, I can't do it, we're done. And because we become so deconditioned, it's hard for us. And so when I went to the clinic again, they said, well, you gotta exercise. So they sent me to physical therapy, but it wasn't your typical physical therapy. I had to do stretching exercises. They made me work. I had to do it. And then I had to go to sports medicine and lift weights. I mean, I couldn't hold a cup of coffee, think about it. And my pain got a whole lot worse before it got better. But there was a point, but it was because I was so deconditioned, and there was a point about 3.5 weeks into my program, and I was walking up to physical therapy, and if you know anything about the Cleveland Clinic, it's about 3 blocks large. So when you walk from one place to another, you're like a long walk. It's not a short little walk. And I'm walking up there thinking, I can't even do this. I'm just feeling terrible. It was a bad day. Went through my stretches that I had to do, going back, and it was like, I feel better. I actually feel better because I stretched. It was an amazing thing for me. It was like, aha. It was one of those aha moments that we get. And to this day, I mean, I have to continue, and I do not like to exercise. I'll be the first one to admit it. I don't like it. I wouldn't do it if I didn't have to. But it's a very small price to pay for being able to function. The problem is, again, I said we're overachievers. So a lot of people, when they're told to do an exercise program, and mine was a sort of a isolated situation because I was there in the clinic and and I actually didn't have to do it. I just thought, I always did what I was told. So if they told me to do them all, did them all. Don't have to do that. So, but when people start an exercise program, they tend to be overachievers. And if you say, you have to do, and we have illustrated stretching exercises in our workbook, but we always tell you, get your doctor approval. We have no idea what your abilities are. No idea. Once you get your doctor's approval and say, approve 3 of the 18, so you go home, right? And you think, all right, if I can do 3, I bet I can do them all. So you're going to do them all. And the next morning, you're going to get up, and you're hurt. See, well, I knew I couldn't do that. I knew it, right? What you need to do, remember we talked about goals and narrowing it down to manageable steps? So say one of the exercises that they approved you for was a leg lift. So what you're gonna do is say, okay, I'm gonna do leg lift. So before you get out of bed in the morning, when you wake up, you do 1 leg lift. Don't have to lift it up real high, just till you feel it. That's it, get up, you're done. You've exercised for today. Haven't hurt yourself, certainly haven't overstepped your limits. The next morning, you're going to do the same thing. You're going to lift it up, that's it, get out of bed. Next week, you do 2. Next week, you do 3. Sounds silly, but it's one small step. I think we all want to start out running. We want our lives back. We want to be like we were before the pain. Well, I'm 30 years, 40 years older than I was. I'm never going to be like I was before the pain. You're not going to be. We're older. We change. But by pacing yourself and doing it very slowly and gradually, pretty soon you're at another exercise, and next thing you know, you're doing a whole series of exercises. But again, our expectation of ourselves, if they say I can do it, then I should be able to do it, right? We don't know how to pace ourselves. I like to use this picture. I was actually born and raised in Pittsburgh, Pennsylvania. And I live in California now. And they used to, on New Year's Day, they were crazy. It was cold, very cold in Pennsylvania, in Pittsburgh. And they'd go to the river's front, the river's edge, and they'd jump in. That water was so cold. They just jumped right in, didn't think about anything else. They're called the polar bears, right? That's what I don't want you to be when you start an exercise program. You can't just jump in and freeze and say, no, put your little toe in. Be realistic, pace yourself. Don't try to do everything all at once. Don't be a polar bear. Pace yourself, little at a time. And think about this, any movement at all is exercise, body motion. You know, sitting still doing nothing, that's the problem. And that's what we do because of the fear. Total picture. It's not about one thing. It's about all of the things we've just talked about. It's about encompassing everything that involves your family, your friends, your whole life. But more importantly, what we do when we have a pain problem and the pain takes over our lives, all we think about are what we can't do anymore. We can't do it anymore. And so we focus on, I can't, I can't, I can't. There's another side of that. There we have these abilities and that we forget about. Now you heard them initially, those folks talking about they had more power than they ever did, even though they are less able. Maybe attitude has something to do with how we manage our pain. You know, is the glass half empty or is it half full? Can we really do this? I believe we can. I believe that there is a way that you can move from patient back to person again, to redefine yourself. But we have to begin to focus on what we still have, not what we don't. I mean, that's depressing. Let's focus on what we can still do, on our abilities. I'm going to show you another little video with some of our members again talking about just this. A significant part of being involved in your recovery is being involved with your peers.
Once I joined the ACPA and the support groups, the knowledge just flowed.
Somebody's always bringing something in to, say, oh, I found this book, I read this book, and, we pass it around.
Everybody who has pain can give something to somebody else. It could be just, oh, I took that and it had side effects, so keep an eye out. Or, oh, I tried doing this and that, and it worked out real well.
When I first started going through the program, I just fought it. I just said, no way. It's not going to help. It's not going to work. And then after a couple weeks, I started seeing the benefits of it.
It's lonely when you have chronic pain.
The first time I walked into a room with people who had chronic pain, what a validation that was for me. It was like, Marianne, you're not the only person in the world that lives with this.
No matter how supportive your husband is or anything, and
tell you the truth, I never would have survived all this without my pain group.
It's just this kind of reinforcement that you're not alone, that there are other people out there going through the same thing.
It's been my lifeline at the ACPA members and having the support group.
You need them.
So we get to our 10th step, and that's really where I started, was the outreach, to reach out to other people. Remember I said I went to the pain program. What amazed me is the whole 6 years I was going through all of my pain problems, I really thought I was the only person in the world that had this problem, and no one understood it. But then I went to the Cleveland Clinic and the pain program, and my word, there were other people there that had pain. I wasn't the only one. And that totally amazed me. And I needed to let other people know, you're not alone. There's somebody else out there who gets it, and I do get it. And you don't have to talk about your physical symptoms because it involves a lot of things about you, not just the pain. Also, what they had taught me there was too good to keep to myself. I thought, you know, this is just really good because I was able to make that transition from that patient back to a functional person again. And this was really good. And I knew I wasn't alone because there were some other people. There had to be someone else out there. But most importantly, I was scared to death when I left the program because I thought, in this controlled environment, I mean, I was there. It was an inpatient program, which is unheard of today, but 29 years ago, they were available. And for the very first time in my life, I focused on me. That was, I mean, never had done that before in my life. And so in that controlled environment, without having to take care of the kids and do all the other stuff that you do, I could live with this pain. But what was going to happen when I got home? And is what I learned here going to last? Because how many times did you do something and it worked for a little bit and then didn't work anymore? So I was scared to death that maybe this wasn't going to work. So I knew I needed to keep up and do what I had learned at the clinic. All of these things we talked about and learned a lot that I've learned since. So the best way to do that is to talk about it with other people. But I needed to talk about it with my peers, people who got it. And that's how the ACPA was born, because it was partly out of my fear of trying to maintain my wellness and keep well. This is how I like to explain a person with pain. Now, a functioning person is a car and it's got all the tires and off it goes. However, if you're a person with pain, you've got 4 flat tires. You're not going anywhere. That's exactly what it feels like. You're just stuck right there. And so say you get the right medication, right? It's going to fill up one of your tires, but you still have 3 flat tires. It's not that one single thing. It's not. It depends on what else you need to fill up those tires. What do you need? And for every one of us, it's different. Things that I've talked about, things that I haven't even talked about yet. It depends. Talk to your healthcare provider. Find out what is available for you and see if you can fill up all 4 of your tires. It may be some, it may be some physical therapy, it may be acupuncture, some kind of injection, it may be, a vacation. Who knows? You have to find out what you need. And then when you get all 4 of your tires filled, you can go. But remember, you have to maintain that car. You're responsible for keeping it running. You take it back, you take your car back to the mechanic to do the oil changes and all that stuff it needs, but on a day-to-day, you're responsible to keep it safe and running. And that's exactly, you have to do the same thing for yourself. It is partly your responsibility. These are some of the manuals I talked about. This is the family manual. And the nice thing about this is throughout the whole manual, there is actual text from the interviews that I did of the family members. And I know when people read it, they sort of say, I could have said that. That's just exactly how I felt. Patient to person first steps, and then staying well, which is an advanced pain management with North skills. Support groups. They can be very helpful. They really can. Knowing that you're not alone. And the interesting thing about our mission, we are here to help people with pain make that transition from a patient to a person. But the whole idea of this organization wasn't to go and be literally all over the world. It was to find someone that I knew was out there, that was sitting there, that was so isolated and so alone, really believing there was not going to be a tomorrow, or didn't want tomorrow to come. I know how that feels. I know how overwhelming pain can be. And I knew that if I could just touch them and maybe talk to them, first of all, just know they're not alone. That's why these groups are so important. You need to know you're not alone, that someone else gets it. And you can, with their support and effort on your part, begin to make that transition. So we have support groups. All you have to do is call our office. I know we have a number of them here in Pennsylvania. I don't know what they are off the top of my head. We do answer our phones. Call our office. The phone will be at the end. We have a facilitator guide that tugs people through step by step how to start a group. So if there's not one here, we will actually work with you. We have a facilitator coordinator. That's a little picture of Tiffany right there. She even writes special newsletters for our facilitators to help them start groups, to provide new information, what issues that may come up in groups, new materials that we've learned. We have all of that information. We've been doing it for 29 years now. All of these manuals that I've talked about, except for the Staying Well, are also available in French and Spanish as well. This is our web page. Here's where you'll find the relaxation technique and also their exercise, and also the in case of emergency is right there. And then there's also another one on there now for fibromyalgia. We started a new campaign, and there's a lot of information back on the table about that. Our web address, our website's pretty active. We get, usually on a low month, 700,000 hits. On a number of very busy months, we get over 2 million hits, and people stay on an average of 13 minutes. So it's something, because there's so much on there. If you don't have access to the internet, call us, because we will get some of this. We can print it off and we will send it to you, okay? So the ACPA is just about people helping people. That's it. And we don't have the answers. We don't have a cure. There's no magic. It's about helping you to take an active role in moving from that patient back to a person again. That's all of our contact. Here's our 800 number. Feel free to call it. Like I said, we really do answer our phone. Keep in mind that we're in California, and if you call at about 9 o'clock in the morning, it's only 6 a.m. there, and people will call us and get a little cranky because we're not answering the phone, but we don't answer at 6 a.m. But we do return phone calls. We do return our phone calls. So if you get the message, leave a message and we will call you back. And now I think we will have time for some question. Anyone have a question?
I'm asking how you finance and how we can help you with the finances.
We've always worked on donations. For many, many years, we didn't have a real office, but we have done a lot of work. Right now, we do a lot of educational campaigns, like the ones I talked about, the It Takes Nerve, the emergency room department, all of those programs, we do get funding from pharmaceutical companies. That's where we get a lot of it, because people with pain don't have a lot of money. And if we look to them to support, because a lot of our materials we donate. I mean, it's not about how you can afford it, it's about the commitment you're making to yourself. So donations are absolutely welcomed. Anyone can do it. But it's actually never been about the money. Many of us work really cheap.